If you're admitted as a patient at Conway Medical Center, the doctor who takes charge of your care while you're in the hospital is called a hospitalist. They're available 24 hours a day, 7 days a week to provide consistent, ongoing care from admission to discharge.
Hospitalist is a doctor that takes care of patients that are admitted to our facility or any other facility. What we noticed back in the mid-90s was that the care of a office-based patient and that of one in the hospital is completely different, and they have different needs. And as the volumes of patients increased and their needs increased, hospitalist physicians came about, and we take care of the acutely ill patients that are staying in our hospital and coordinate their care throughout their stay, and then when they leave their stay to go back to their primary care physicians in the community.
So what type of training do hospitalists receive?
Typically, a hospital physician is either internal medicine trained or sometimes family medicine trained, and we are responsible for all organ systems and all care of the patient in the hospital with the help of our specialists and our other proceduralists that coordinate their care along with us in the hospital.
How do hospitalists work with primary care physicians?
With the bringing about electronic medical records, it does help to have our primary care physicians' notes available to us. Often we will call them or talk to them during their stay. But yeah, typically it's the first time we've seen a patient, and we rely on talking to the patient and the care of their primary care physician along the way, and we kind of communicate with them to coordinate their care while they're here in the hospital.
I asked Dr. Bradford what he enjoys most about being a hospitalist.
I like the acuity of the patients. I like being all over the hospital, multitasking throughout the day, and really, unfortunately, seeing people often in their worst times, but also seeing them as they get better and can go back out into the community and see their regular doc. I always knew I wanted to go into medicine from the time I was real little, just to help people. And then as you go through medical school, you start to find your niche, and mine was, again, in hospitalized patients. That I like the critical care nature of the patients that we see. I like seeing people get better, and that was my niche.